Wellness Webcast. I am Mo Wolf, CEO of Little Honeys LLC, the makers of Bee Rescue Propolis Care and Bee Energized raw bee pollen products. This is the Wellness Webcast, the fastest half hour on the internet, bar none. This is our little outreach here at Little Honeys, where we try to provide you with some good quality wellness, health, and just general good living information. It is officially fall here in southern Wisconsin. Fall having arrived last night at around 5 o'clock for us. Those of you that are weather geeks and calendar geeks are going to be looking at your calendars saying, no, it's not. Well, hey, in my book, it's fall. 5 o'clock last night, we got hit with a cold front that came through and just knocked the tops out of a bunch of trees. It was a beautiful, beautiful storm. Stormed all night, in fact. At one point, I went out with my buddy to go watch the storm, got in the truck and drove around for a little bit. There's my buddy right there, good old Hank. Had a wonderful evening. We are here to talk about all things health and wellness. And this week I wanted to talk about stroke. The reason I want to talk about a stroke, and when I say stroke, no, I'm not referencing a Clarence Carter song, and no, this has nothing to do with rowing. I mean stroke, as in problem with the brain, blockage of blood supply to the brain due to some sort of blockage, a brain bleed from a hemorrhagic stroke. This is what we're talking about. And the reason it's so important is because stroke is the third leading cause of death in the United States. In fact, depending on who you read, between 500,000 and 800,000 people are affected with stroke each and every year. That's some pretty significant numbers. And what's even worse is 1/3, that's 33%, of those folks who are affected with a stroke, 1/3 of them are going to die. So this is a very serious subject, and I know we've been on some pretty heavy topics as of late, but these are important. There is a time to laugh, there's a time to have some fun, that we do, but these are important topics that we need to discuss. Now, what are the symptoms of stroke? There's an acronym that I'm sure you've all seen. I'm sure you've seen it on the billboards around town where you're driving. I'm sure you've seen it on the news, the TV. But the acronym is FAST. You can see it right there above my head, hovering. The acronym is FAST. It stands for facial paralysis, arm numbness, tingling, paralysis, speech impairment, or tongue deviation. Deviation meaning it's moved to one side or the other, deviated to the side. It's a person who is affected in such a way they can't stick their tongue out straight. They're going to stick their tongue out. The facial paralysis is, well, what would that look like? It's going to look like either the side of the face is drooping, or maybe their mouth is drooping, maybe there's drooling involved, the old werewolf look. Maybe their eyelid is drooping, and they can't keep their eye open, or maybe they can't close their eye. Some symptoms of stroke. The arm numbness. Oh, my arm feels really numb, and I can't get feeling back into it. Banging it. Tingling, or my arm is just totally paralyzed. come on, come on, come on. And it just doesn't want to work with you. The speech impairment. You talk to some paramedics, and they'll tell you, yeah, oftentimes these folks will sound like they're drunk. In fact, a dear friend of mine, her father suffered a stroke about a year ago, and her father, the paramedics actually thought he was drunk and didn't want to take him to the emergency room. Somebody wasn't paying attention. So you've got this acronym, and the reason I put this up here is because this is one of those tools that could actually save your life or the life of someone you love. Now, again, we've all heard the public announcements, public safety announcements and service announcements, but how often are we really paying attention? If I take that off the screen right now, can you tell me what fast means? Huh? Can you? Bam! There it is. Bam! It's gone. Haha, gave you a hint. Fast. Facial paralysis. Arm numbness or tingling. Speech impairment. Tongue deviation. These are things to remember. Now, why is that important? Well, because they're symptoms of a stroke. And a stroke is a disorder that results in brain damage and can kill you. And those whom it does not kill, it tends to maim. It's like a rabid lion going out there and just chewing on people, and those that it doesn't kill, boy, they're pretty well banged up. But what are the risk factors for a stroke? Risk factors of stroke include, but are not limited to, atrial hypertension, heart disease, elevated plasma cholesterol, diabetes mellitus, oral contraceptives, smoking, polycythemia, thrombocythemia, and... Thank you, Mr. Sadler. One of the main risk factors is being over the age of 65. Well, you can't say that. That's being insensitive to our senior citizens. No, it's not. It's calling a spade, man. You're over 65 years old. Most folks that are 65 years or older tend to have a number of these symptoms, a number of these risk factors going, rather. When we get to that age group, we run the risk of stroke. We've got other patterns of disease going on that put us at risk. That's what I'm saying. Now, there's three basic types of stroke. We're going to talk about them. The first we're going to talk about is ischemic stroke. An ischemic stroke occurs when a blood vessel is blocked by a thrombus or an embolism. Thrombus is, to just put it in very simple terms, it's a blood clot. Back during the opening days of the Gulf War, the Second Gulf War, there was a journalist embedded with some troops. He'd been sitting in the back of a Humvee, driving along, bouncing along, singing his song, and got this terrible pain right back here in the calf of his leg. And he just, what do? You get a pain, and oh, that hurts. And he started to massage it. Well, that broke the blood clot free, and it ended up traveling up the femoral artery and ended up going into his brain, and he stroked out and he died. I wish there were another way to put it. But he had a thrombus, the blood clot in his leg, and the thrombus broke loose and became an embolus. And that embolus is anything that's intravenous that detaches from some structure within the body and travels through the circulatory system and ends up clogging a arterial or vessel that feeds the brain. Now, you can have an embolus in your lungs, you can have an embolus in a number of areas, but when it goes into the brain, it's called a stroke. These can be either temporary or they can be permanent. Either way, there's fallout. Now, the strategy for treating an ischemic stroke is to, that clot that breaks loose, that embolus that travels up into the brain and gets stuck, the strategy for treating that is to, as soon as they can, they pump you full of these drugs, these TPA drugs. They're anticoagulants. Probably said that wrong. I can't talk right now. Hey, just because I have one of the signs, don't rush me to the ER yet. I shouldn't joke about that. With the ischemic stroke, you have the embolus that traveled up into the brain. It's blocking blood supply to cells in the brain. Those cells are getting hypoxic. They're starved of oxygen. They're starved of glucose, and they're dying, and they're becoming necrotic. Necrosis is beginning. Which means that there's damage, because if you have necrosis in brain tissue, you have brain damage. Eating paint chips isn't just the only cause. Getting dropped on your head as a little kid isn't the only cause. Anytime that the brain is starved of its oxygen or glucose, i.e. in the blood supply, there's going to be some brain damage. There's fallout. So the doctors are going to pump you full of this TPA drug, and that TPA drug is designed to go in and actually dissolve these clots. If you've had an ischemic stroke, one of the TIAs or a mini stroke, that tends to have much shorter term symptoms, and sometimes they don't give you TPA for something of that nature. Sometimes you'll go in after a transient ischemic stroke, and they'll say, yeah, you had one. Lucky that you came in. Now we know. We're not going to put you on TPA. What we're going to do is we're going to just put you on half an aspirin a day and see how things work. Well, aspirin's an anticoagulant. Aspirin's going to work similarly to that TPA. Maybe be suffering from a stroke. Remember those symptoms: the facial paralysis, the arm and numbness, tingling, the speech impairment, or the tongue deviation. Give them some aspirin right away, and call 911. So once you're there, I mentioned the TPA drugs. TPA drugs are an amazing advancement in medical science. They're TPA, tissue plasminogen activator. Basically what they do is they dissolve that clot. And the latest and greatest TPA drug is called Ancrod. What's wonderful about Ancrod is it gives you a much wider window of treatment. In other words, if you get there, say you can't get to the hospital within the first 45 minutes to an hour, maybe you're 3 to 4 hours late, they can still give you this Ancrod and get some pretty good results. Now, the Ancrod, interestingly enough, and I find this fascinating, was actually developed based on certain compounds found in the venom of a Malaysian pit viper. A lot of pit vipers tend to have these compounds with rattlesnakes, etc., except that Malaysian pit viper has this compound, Ancrod, in it to a greater extent. I find that fascinating. Fascinating in that you've got these substances that are so important for heart health, reactive heart health. You've got the ACE inhibitors. That too was synthesized based on a protein found in snake venom. This time a pit viper, another pit viper, but from South America. I find that interesting. Let's get back on track, shall we? Regardless of the stroke being a transient ischemic stroke, something minor, or a full-blown stroke, Time is of the essence. So if you start seeing these symptoms, facial paralysis, arm numbness, tingling, arm numbness, arm tingling, arm paralysis, speech impairment, tongue deviation, if you see any of these, that's a very good indication that there's a problem. Get that person to a hospital. Or, in the words of William Shakespeare, get thee to a hospital. How's that? The problem is a lot of folks will have a TIA, a transient ischemic attack, transient ischemic stroke, and they'll think, whoa, that was weird. No harm, no foul, and they'll go on throughout their day. But the problem is 80% of these patients will have reoccurring stroke symptoms. In other words, they're going to stroke again. 1/3 of those people will end up having a full-fledged, full-on, no-holds-bar stroke within 5 years. Because their behavioral lifestyle has not changed. They're still living that high-risk lifestyle. The beauty about getting treatment after a TIA, a transient ischemic attack, is that then you can make those changes to lifestyle. You can start using those blood thinners to try to reduce the possibility of another attack. That leads us to the hemorrhagic. The hemorrhagic stroke is not as common as the ischemic or the thrombotic. However, it is the most lethal. It is, just as its name suggests, it's a brain bleed. It's caused by ruptured aneurysms in the brain. It's caused by vascular malformations, hypertension, bleeding into tumors, bleeding disorders in general, head traumas. All of these things can lead to a hemorrhagic event, hemorrhagic stroke. A hemorrhagic stroke is so dangerous because not only does it starve parts of the brain that were downstream from the event of the much needed blood, which is carrying the oxygen and the glucose, but it's also causing hemorrhage within the brain, which is increasing intracranial pressure. Now, your skull is a confined space. It's not going to expand and contract very well, which is why when there's serious head trauma, they'll often go in and they'll cut out that part of the skull where there's, brain swelling occurring. So that way they can relieve some of that intracranial pressure. But when you've got a hemorrhagic stroke happening and that hemorrhaging is occurring and that pressure is increasing, that volume is staying the same. Now, according to Gay-Lussac's law in physics, where pressure increases where volume stays the same, temperature increases. Now, within the body, where pressure increases and volume stays the same or is limited, inflammation occurs. Very acute inflammation, and that's very, very dangerous to the body, especially when it's around your brain. So you've got this increased intracranial pressure. You've got one section of your brain being starved of oxygen and glucose and can't get rid of the waste product from basic cellular function. And so you've got that part of your brain dying, and then you've got the whole of the brain experience this increased intracranial pressure, which is causing inflammation, which damages other parts of the brain. You end up with a much more global effect, if you will. But what's exciting is we're living in a day and age where we have such things as TPA. We're living in a day and age with some very wonderful advanced medical techniques. Now, I practice, as some of you know, I practice alternative medicine. I practice Chinese acupuncture and herbal therapy. But I just said we're living in an age with some exciting medical advancements. I'm not supposed to talk that way. Well, wait a minute. There's a time and place for alternative therapies. There's a time and place for reactive medicine. A few weeks ago, I was having one sassy asthma attack at about 2 a.m. Liver invading lungs, thank you very much. And I woke up, I couldn't breathe. Luke, I am your father. And my lips were kind of going blue. I was looking like I was checking out soon. And so I went and I got my son's nebulizer. And I got a little bit of that albuterol sulfate. I think it was 2.5 mils. Put it in there, and I took the little mask and I took that albuterol sulfate, and it probably saved my life. There's a time and place for reactive medicine. Reactive medicine is there for those very acute emergent situations. Now, that doesn't mean that all of them have to be reactive Western medicine. Some of those, quote, emergent acute situations, yeah, you can treat them with alternative means. But the biggies, cardiovascular events, breathing events, things of that nature, you don't want to mess around. And that's why we've been given this gift of Western medicine. That said, for sprains, someone's walking around and they twist their ankle and their ankle goes pooch. Looks like they got a grapefruit on the side of their ankle. You know what? Chinese medicine can actually increase the healing speed of that ankle. Something like shingles, that's a very serious infection, viral infection. Well, guess what? Alternative medicine has a very good track record with shingles. But just like with stroke, time is of the essence. So when you are dealing with any kind of pathology or disease or injury, make your determination, make your decision, and go get treatment. Neat thing about stroke is after you've had a stroke and you're dealing with the fallout of it, the sequela, the side effects of a stroke, you know, that's the Huffington and Puffington Post had an article that listed some of these that are actually treated by acupuncture. September 29th, 2011 at 3:30 p.m. Woohoo! There was an article written by Atsuki Maeda, who is a licensed acupuncturist. Doesn't say where she practices out of here, but she wrote an article entitled Innovative Stroke Rehabilitation Acupuncture. Say that fast. The benefits of integrative therapy. And what she says is she lays this wonderful foundation for those folks who have had a stroke and are laid up, maybe half their body's shut down. And she's trying to get the point across that doesn't have to stay that way. Using acupuncture, you can get some strong and really amazing results. They listed, quote, treatable symptoms. See, right there, treatable symptoms. Hemiplegia, aphasia, difficulty swallowing, facial palsy, blindness, shoulder pain and partial dislocation, inversion of the foot, hearing impairment, constipation, dysuria, urinary incontinence, bed sores, cognitive disorders, a bunch of stuff. All of these things can be treated with acupuncture. So when you're post-stroke, you've been to the hospital, you've been given the TPA, or maybe they've gone in and if you've had the hemorrhagic stroke, they've gone in, they've saved your life, they've clamped off that bleeder. Now you're dealing with fallout after the stroke. As soon as you can, you go and you get thyself to an acupuncturist. Get thyself to an alternative care. Get thyself to somebody who can do some complementary treatment and help get you back on your feet quicker. A few years ago, there was a fantastic film entitled 9,000 Needles, and it is a film about a fellow by the name of Devin Dirth who had a hemorrhagic stroke and ended up going to China, to a traditional Chinese medicine hospital for to get some acupuncture. And this story is of his journey in China through the process of healing. Now, hopefully he will be able to continue the process and continue getting better. He saw some amazing results, but he didn't fully heal. Part of that was because of the distance between the injury and the treatment. Just like the advertisements say, with a stroke, time lost is brain loss. Well, with a stroke, time lost is also functionality loss. So, let's go back and let's review this. If you see somebody that is exhibiting any of these symptoms, the facial paralysis, the arm numbness, tingling and paralysis, the speech impairment, the tongue deviation, yes, remember that. Get that person to a hospital. That person is most likely having a stroke. They need help. Just save their life. Might just save your life. Now, why do we do this? Why do we at Little Honeys do these broadcasts? We do it because we care about our customers. We do it because getting that information out is the right thing to do. Whether it's making a product like our Rescue Balm here that will knock your socks off and change your life. Maybe you've got MS. Maybe you want to put that over the joints that are aching and just so sore. Maybe you were out and you got yourself sunburned and you look like a lobster and you put that on and you soothe the sunburn. Maybe maybe you're a martial artist and you've been working out and you're very, very sore. Put that on the muscles and oh, it feels good. All of our products were made and designed and formulated to work because we care. Just like why we're doing these videos, it's because we care. We want to bring you relevant information that will be a blessing to you and your family. So we're running a little long here. On behalf of all of us here at Little Honeys, I want to say thank you and be